up to a million typically to invest. Those are not huge checks. I mean, for a seed round or a pre-seed round, they're nice checks. But when you get to a Series A, or even a big seed round, any more of those aren't. But we're finding that we're being invited in to Series A, Series B rounds, writing a $500,000 check because
Thank you so much for tuning into Journey with Christian D. Evans podcast. I'm your host, Christian D. Evans. This next guest is an experienced early stage investor, manager, and board member with 25 years of experience with new venture formation, governance, business development, and commercialization. In his role as managing director of Ventures, he is responsible for investment, commercialization, and technology transfer for the organization, which we're going to be unpacking quite a bit, definitely in the medical side of things. In this capacity, he works with investors to spin technologies out of and he works with leadership to source best-in-class external solutions to address system needs. What is that? Well, that's why you got to listen to this next episode. Please welcome my next guest, the one and only Neil Wyant. How you doing today, Neil?
I'm doing great, Christian. Thanks for having me on your podcast.
Well, I appreciate you jumping on, man. And you have been through all sorts of fun activities. And I just gave just a small, very quick bio because I really wanted to dive into who you are, what you stand for, what you're doing now. But real quick, before we dive into all the fun stuff and the venture and the investing, let's take us all the way back before college. Who's Neil? Who's Neil Wyant, and how did you get in? What you're doing now, man?
Sure. So, my path to where I am now was anything but direct, as you'll hear in a minute. It all made sense in the end, but it was not predictable. I was born in Arizona, where my father was the base dentist at a base that's now closed. I was there for only about 6 months before the family moved to Ohio, where I grew up. I grew up in Akron, Ohio. Uh, Nice small community, strong Jewish community where we lived, where a lot of people, everybody knew everybody, and everything that went on. Um, had the privilege of attending a really high quality public school system. At the time, it was just an excellent program. Um, it was not very diverse, unfortunately. In hindsight, I recognize that. At the time, I'm not sure I did, but I got a great public school education. Um, and to this day still have a lot of friends that go back to even as far as preschool, going to school in Akron, Ohio.
See, what I find so interesting is, how did you get into the healthcare space? Because you obviously are University Hospital Ventures with this Ventures, just to reiterate that for our audience. So how did you get yourself into the healthcare world?
So I was exposed to medicine very early on. My father, as I said, was a base dentist, but he was an oral surgeon. And back in those days, he and his buddies used to get together at our house to watch the latest. It was a reel to reel film on a procedure. So when they wanted to learn new procedures, they would send these films out. The doctors would get together. And as a little kid, I used to sit on my father's lap with his buddies while they were sipping their scotch and watching people cut into whoever or whatever they were doing. I was sitting there watching, and I was enthralled by it. I enjoyed the way they were talking and engaging and laughing, and they were all committed to helping people, which I just picked up on inherently. And so when I had an opportunity when I got out of high school, I thought I wanted to be a doctor and went into biomedical engineering as a path forward.
So with biomedical engineering, how did you get into the investing ecosystem then?
Again, a bit of a circuitous path. When I went back to when I went to undergraduate, I started off as a biomedical engineer, uh, and pretty quickly realized that you need to specialize. And I ended up going down a path which was more chemical engineering focused. And when I got out in the early 80s as a biomedical engineer with an undergraduate degree and a chemical engineering degree undergrad, chemical engineers who were really hot in the late 70s, um, that market fell apart for us. Probably before your time, but that's when there were lines at gas stations and the first embargoes were taking place, and the world was thrown up. So I ended up going out and starting to do other things and ended up in a sales and marketing role with a big industrial gas company based out of France, Air Liquide. And it was a great experience. And I will get to how I got to medicine. But again, it was circuitous. I started going down a path, and really, I ended up in a sales and marketing role with a company and found myself spending time with a couple of very small clients, disproportionately committing time to these places because of the energy and the excitement that they bring. They were both startups. One was a spin out from Lockheed Martin's Skunk Works. I was a sales rep down in Southern California, uh, very entrepreneurial area. And the other was just an entrepreneurial spin out that had raised um, what we would now call angel capital, but they went out to a bunch of high net worths and raised capital for their. And I just loved the energy, and I found myself just spending a lot of time. And when I transferred back to our marketing center back in the Chicago area, I went back to business school, and I did that at the same time. And when I got into business school, at a certain point, I decided that I needed to finish it up quickly. Going at nighttime was a lot of work, and it was very disruptive to things. And I had this energy, so I went back full time for my last year, and I was at the University of Chicago, which is a fantastic school with great educators. I had great student colleagues, um, but it's a bit of an ivory tower. And I was a much more of a hands-on. I was out in sales. I was calling in manufacturing facility. I was very hands-on and felt the need to engage in a hands-on way. So I volunteered for what was a startup within the university at the time called Arch Development Corporation. It was the tech transfer office, and they had just formed the very first venture fund dedicated to university and national lab technologies, first one in the country. So this was back in the late 80s.
And that's how you evolved into this kind of space. So this is interesting. So going from there, being part of the startup, what skills did you learn during that time that helped you then kind of evolve into running your own investment thesis and investing processes and raising capital for other things down in the future?
So probably bucket that into diligence skills and listening skills. I had the privilege of going out and being on the front lines of Argonne National Laboratory, which the university managed under contract to the Department of Energy. And this was in the early days of something called the Bayh-Dole Act, which enabled nonprofits like the University of Chicago to actually take title to intellectual property resulting from federally funded research. So I went out there and I was on the front lines, and our business model at Arch was different than most other tech transfer offices in the country. We had personal incentives, we had bigger incentives to start companies, and we had secondary incentives to license technologies. And I had a personal carry in all of those deals like everybody else did. So incentives worked, and we just started executing. So I really learned diligence skills and learned how to sort through and prioritize seminal technologies from really interesting but maybe just incremental advances in technology. And those incremental advances could be important to an existing company, and you would want to license that out and get a royalty stream back to the institution. But these seminal technologies, we had bigger visions for. And I had the privilege of working with some really smart folks who went on to form Arch Venture Partners, which has now got over $1 billion under management. And I learned a lot from them about spinning companies up and out of academic institutions and bundling technologies to create enough critical mass of IP that you could go and raise capital around. So, those are some of the skills. And then on the listening side, I would come in and be meeting with people who were potential Nobel caliber inventors. Right? These are the people who were at the University of Chicago and Argonne. And there was so much to learn. So I really learned how to be an active listener and parking lot my questions, write them down so that I didn't forget them, but still remain engaged with these really super smart, super important people who were inventing the world's next things.
So what I find interesting, and I appreciate you kind of diving into both of those, and I want to loop right into kind of your underwriting because I want to talk about the listening, character trait here very shortly. But really, the underwriting process. You mentioned you like to gravitate and deploy capital and invest your money into things that are actually going to be, revolutionary, if you will, right? But I want to ask, how were you able to discern that? Because obviously that, from 90s to the 2000s to obviously now 2020 and 2024 and beyond, right? My point is that it is evolved and it's constantly evolving. So, what does that methodology look like? How has your investment thesis or your methodology or the process you filter these companies? What are you looking for? If you could dive into that a little bit further, and then as well as how has that evolved over time?
Sure. So, I think there's an old adage that venture likes to invest in an A team and a B technology before they'd invest in a B team and an A technology. And the logic there is, you know, people are hard to change. Your people do get hardwired, so they do have ways of acting. So when you get into a situation where you need to pivot, the product market fit may not be quite right. There's something you're on the right track, but it's just not quite fitting. It's way easier to change your product and technology than it is to change your people. Going and bringing people onto a team, incorporating them onto a team, changing the mental models that the teams use. Those are those are difficult things to do, if not impossible in many cases. But technology, we can go out, we can go get it from this academic center, we can go bring this inventor on. You can do those sorts of things. So that was one, I think, principle that I learned early on. And there were I can think of a couple examples where I forgot that principle and we bet on the technology and it did come back to either harm us, where we either had to bring in new people or we just shut stuff down. So that's a big learning early on that's carried through, and literally to this day we just had this conversation about an opportunity where we think the technology is super cool, has super interesting opportunities in the marketplace, potentially really broad applications in the marketplace, but we don't think the team can execute on it.
Gosh, that's a tough decision. So really you rely on that underwriting of a team more so than technology. You say, "Hey, that technology is awesome, but let's kind of push that to the side. Let's really underwrite the team and understand are these A players?" And I've heard that numerous times, definitely in the VC world, definitely in the startup world. And I'm curious, how do you identify an A player team, right? Are there certain things that you are looking for, specific qualities, not just on, hey, do they have the degree? Do they have the education, right? That's part of it. The other character traits that, hey, you know what, when they're behind a corner and they're back down, are they going to keep pushing forward and figure it out, right? How do you determine that and identify that at the beginning of that underwriting process, since you rely on the team aspect more than the technology itself?
Well, some of it is a bit hit or miss, and I think the more people you can speak to within a company, the more people you can speak to who are advisors to the company, the more you can tease out how receptive management is to recommendations and how coachable they are. And when they feel strongly about something, what's their style? Do they have, I worked with a lot of Israelis who have very much an in your face aggressive style. And if you're used to that, that's fine because you can actually accomplish a lot more in a shorter period of time with the directness. But you have to know that if you're not used to that, you can be very put off by that sort of personality. So, some of it is just talking to enough people and doing enough diligence about the people. Ideally, they've had some experience. You know, could be failures, and in which case, I want to know what they learned. I don't want people to say they've never failed. If somebody tells me they've never failed, I'm assuming this first time they fail is going to be on my nickel, and I don't want that. So I like people who can admit that they failed at something, or they may say, I never failed, but it didn't work out the way I expected. right? I'm okay with that. So I think you just meet people, you talk to people, and and then you have enough people on your team who you trust who bring different perspectives to, again, you ask people the same question by three or four different people, you see what answers you get back. If there's not consistency, and we drill down, if we don't have consistency, they're probably not the right people.
That makes perfect sense. Has that evolved over time? Have you also got like because you've done it so long, you've been in the industry for so many years, you can kind of intuitively almost get a feeling of like, hey, I know this person has it or they don't have it.
You can get a sense for the nature of the person. There are some very quirky technical people who are quite competent at technical management, right? And if they're comfortable within that space and bringing people on to do the other pieces, that's fine. So I think over time, your radar, you get a BS meter going, right? And if people will look at you in the eye, some people will, some people won't. Though there are these sorts of signs that um, the people in HR, the really good recruiters, have taught me some of these things as well. See how they respond, look at them, see how they handle that uncomfortable silence.
That's good. I like that. I gotcha. Well, so I want to dive into a little bit on the actual product line itself, okay? Because and I'm talking about when you are investing in these companies and there's a lot of different verticals and a lot of people are not familiar with this. So I want you to kind of break this down for our audience. In the medical world, there's a lot of different verticals that you can invest into. But I know Ventures, you guys invest kind of into one side of vertical, specifically med tech, right? Medical tech, technology, more so than like FDA approval drugs and stuff like that. So I just want to differentiate that. If you could break that down for us and why you guys gravitate more toward that more than anything else. Obviously, emphasizing the team, that's important, but I want to dive into the actual investment thesis in regards to the products you guys invest into.
So we invest more broadly than just medical devices. We don't do therapeutics. We invest in pretty much everything else, and in fact, our portfolio is pretty heavily weighted to things that people would bucket under healthcare IT or IT enabled technologies, technology enabled technologies in healthcare. Um, Central to our thesis is we need to have a problem that's being solved by the solution that's being presented. So we start with a problem. We try to start with a problem and source solutions against that problem. So we do some sort of over the transom stuff that comes in, and then we go out and see if we can find. But the first thing we need to do is have a strategic relationship with the company. And as investors, we think that gives us a competitive advantage because through that strategic relationship, which could be maybe they have a fully baked product and we become a customer. It could be they don't have a fully baked product and they need a place to do product development or they need a place to pilot. But those early opportunities to engage give us a sense to how the company can deliver on their value proposition. So we want some insight into the value proposition and the company's ability to deliver on it and work with our operating people before we make an investment decision. So that is really central to everything we do. So that's our starting point. Um,
Okay. So just to kind of reiterate, so you're looking at the team naturally, underwrite the team, you underwrite the product itself naturally, but within that, you're also looking at specifically the IT kind of vertical in the medical space, and you basically are asking these companies, these founders, and saying, hey, where are you at? Do you need more R&D? Do you need more product development? Do you need more, product launch and
right.
market
As a
fit,
strategic,
etc.
we want to be helpful, right?
Right.
How can we help our portfolio companies? When you say you've got a strategic investor, you want them for more than their money. In fact, what we're finding is even though we write relatively small checks, typically 250 to 500,000 would be a first check, and we'd keep the balance of up to a million typically to invest. Those are not huge checks. I mean, for a seed round or a pre-seed round, they're nice checks. But when you get to a Series A, or even a big seed round, any more of those aren't. But we're finding that we're being invited in to Series A, Series B rounds, writing a $500,000 check because they want us as a strategic on their cap table, and because they can say a customer has invested in us. And then the portfolio companies who really maximize the relationship then have us facilitate introductions to all of the syndicate partners we have in our other portfolio companies, which include a couple of dozen other hospital system venture firms. So it's how we engage with them.
I love it. I love it. Very strategic, and you're really having those really honest conversations. I want to kind of talk a little bit about, we always, on this podcast, we like to talk about kind of the perfect example. We also like to talk a little bit about the negative examples. And what I mean by that is, like, you know, the real world is kind of in the gray area sometimes. It doesn't always work out, right? Some investment, maybe the team, maybe the situation, maybe the product just doesn't fit, whatever it is. And there's certain times where you have to kind of, sway away from that relationship and spend your time and energy on other portfolio companies that are producing better results, right? And that's just the name of the game. So you have to have those tough conversations. Are there certain red flags that you start realizing? Like, let's say, for example, they've been in R&D for 4 years and they haven't gone to product launch, right? Is that kind of a red flag? And you're like, okay, well, we got to stop, or is it very contextual? Help us understand how you guys think about that for your portfolio companies on a strategic basis.
So on a quarterly basis, at least, we go back and monitor performance against the key milestones we expected the company to hit. A lot of the companies have ARR targets, right? How much recurring revenue, annual recurring revenue do you anticipate, right? And we want to track that because exit values for those companies are typically based on ARR. So for those businesses, that's a metric that we check, that we monitor, and that we try to hold them accountable to. And if they're not hitting their metrics over one time, next time, third time, one time you can explain it away, maybe even 2 times you can explain it away. When you start missing the same target metric 3, 4 times, there's probably something more systemically wrong. And that's when we start really probing more deeply to see, is this something that we can fix or not? So that's one thing that we do. And they're not necessarily revenue metrics. It could be development milestones. We start early. So maybe we're going a little more slowly. Okay, during the pandemic, everything went more slowly. All of the milestones got moved back, right? But how are they reacting to that? Are they doing anything to slow their burn? If they know that their milestones are getting stretched out, are they taking any strategic actions? Are they going out and saying to their board, we may need to get a bridge round? Should we start talking about doing an insider round to get us over this hump? Right? So are they coming in early and telling us they have a problem? That's a good thing. The worst thing that can happen, and I've got a company that this is happening to right now, the CEO came in late and said, we have a big cash flow problem. And I'm an observer on that board. And one of the board members said, when did you figure this out? She said, well, it's been a few weeks. And the response was, why didn't you call us right then and there? Right? So that happened twice. So the first time, entrepreneur who was not experienced, we knew that going in. We knew we would have to do more coaching and mentoring, and we're comfortable with that. But, so first time, it's my mistake. Second time, it's your mistake, right? Third time, it doesn't happen.
I love this. I love this because you're going right directly into the tough conversations. So for the first time founders, you do give some leniency, but also at the end of the day, it sounds like you guys are in it for the long haul. You're like, hey, we'll figure this out. Let's make this happen. But when it's happening 3 or 4 times, then now it becomes a pattern. And it's like, okay, well, what's going on? We got to restructure it. Has there ever been a time where I was talking to a friend of mine and he runs a VC as well, in order to mitigate their loss sometimes, sometimes they don't let the company go all the way to zero and totally strap off. A lot of times they're looking at an exit. Maybe it may be pennies on the dollar, right? But at the end of the day, they have some sort of exit so they can literally
Yeah,
mitigate that loss. Do you structure the same way? How do you guys approach that on the back end?
yeah, that's a conversation that the board was having. What might we do? Who might buy this asset? Because even if you get a fraction of the money, the your preferred shareholders will get some of their money back, right? And at a minimum, what you can do is take care of your syndicate partners. And if you're a CEO, taking care of your shareholders is only going to come back and help you the next time you go to raise money from them. Even if it's not a great outcome, if you show good faith, I think you get a little bit of a pass. At least you get a couple of points in your direction.
That makes sense. Brownie points, right? It adds up. But okay, so let's dive into a little bit more. Neil, I'm always intrigued with the medical space. Definitely in the IT, it's cool that you gravitated. Though, has that always been your guys' thesis, or has that evolved over the last 10, 15 years?
So I've only been at UH just under 5 years. So I'll just sort of frame that. Um, Part of the reason we started there was many of the opportunities we looked at didn't have regulatory requirements. So, for example, and this is all public knowledge, so I can talk about this, and we invested in a company called Roundtrip, which provides non emergent medical transportation. There's no 510K, there's no FDA. We invested in a company called TaylorMed, which helps our financial navigators identify philanthropic sources of funding for our patients who need help, especially our oncology patients, where treatments can be so expensive and some of the CAR T and advanced therapies, which can be hundreds of thousands or millions of dollars over time. We invested in a company that will get our patients hopefully to the front of those lines and access that capital so that they don't either go without or go bankrupt. We invested in a company called Script Drop, which provides pharmacy delivery services. Again, not, it helps our patients stay on their protocols. One of the reasons patients fall off protocols is because they don't have transportation to get to the drugstore. So let's remove those barriers. So a lot of the reason we were investing in those was because the commercialization barriers are lower and less risky. There are other challenges, lower barriers, more people can come in, and those are competitive marketplaces that I was just describing. But there are different barriers. And again, if you figure that there are going to be a couple of companies in each of those spaces that are going to probably win, your job is to figure out which one or two is going to be a winner and bet on them.
So when you guys are looking, and this is interesting that you kind of dive into this, when you guys are looking to go to market strategy for a lot of their technical, their product, right? Because it's more of an enterprise kind of focus, right? The healthcare industry, it is very focused on hospitals and those larger organizations, which is more enterprise. Do you find that the sales cycle is for a lot of these scale for these companies to scale to that higher level? Because it's not like a typical SaaS product or anything like that. It is more enterprise, so you can't just target small business, right, and get a better conversion. The sales cycle is a little easier on the front end, but obviously with these enterprise, the sales cycle tend to be, I would imagine, it's probably the same for the medical and
Sales cycles
healthcare
also.
industry. Yeah. So
Um,
how do you guys kind of compensate for that? Do you guys just have to go through a lot of burn to anticipate that? But when you guys do get those enterprise or long contracts, how do you guys anticipate that for the growth?
well, I mean, some of that is just you got to build into the plan and you've got to be operationally savvy enough. And this is part of what we look for in an entrepreneur. Are they are they savvy enough operationally to be able to scale up at the right time and hold back? Where are they deploying their resources? Um, you know, it is the whole this whole IT space is challenging because all of our IT departments are always backed up. So you talk about time delays. A lot of what we do within our office is shepherd companies through a process. So for our own sake and for theirs, we try to shepherd them through. And and the other thing we try to do is facilitate introductions to other hospital systems so that there's at least warm introductions. So that even though the cycles are long, if we can get them into our system and generate data that they can then use and take out, or one of our hospital system partners can generate validating data that substantiates the business case. I mean, at the end of the day, we all build a business case. We go out and we test to see, are they delivering on the business case? Are you reducing length of stay? Are you reducing the cost of delivery of service? Are you increasing the revenue from this patient in this area? You know, we're looking at those sorts of things um, in our pilot, and then we'll use it. Or similarly, we'll go and find other hospital systems with whom this company is partnered, and we'll leverage. We've spent a lot of time over the last probably year and a half, in particular during the pandemic, building our hospital system venture network because we rely on each other. We know that our hospital system is one, and we're unique. And while, you know, here in the Cleveland area, we have a very competitive healthcare market. We have the Cleveland Clinic, which everybody knows about, but they're a different sort of beast. There's only, there's the Cleveland Clinic and there's Mayo and Scripps, and there's three or four that are like that. Then we have another hospital system in our region, Metro Health, which is our community hospital, right? Very different. And then we're a big regional hospital that's been cobbled together by the acquisition of other small hospitals. We tend to be more like other hospital systems in the country than certainly than somebody like the clinic. So when they generate data with us, they can take that to a lot of other hospital systems and vice versa, which is part of the reason we work so closely with syndicate partners across the country.
Were you the one that brought in that idea, that focus? Because I love that a concept where it's not just the resource or the mentorship or just the equity or the cash that you bring in, right? But it's also this amazing Rolodex of people, of connections, of network. So when they're going to market strategy, whatever that is, it's very easy kind of conversion. So was that your idea to be able to bring more resources to your portfolio or company? How did you guys integrate that? I'm just curious. It's an awesome platform.
So I would like to take credit for the idea, but this is an idea that many people have deployed. I think we brought it in and we made it a strategic issue for us. We had objectives of building relationships with these types of groups for deal flow, for diligence, and to have stronger syndicates because you need that, especially at times like we have now. You need a strong syndicate at the table who can support a company that may be missing their milestones and may be needing some cash, but is still a pretty good company with a good team behind it, and market dynamics, got the best of them. So you need to help some of those companies out. And having a really good syndicate with you makes all the difference. So for really all of those reasons, diligence, pipeline, syndicate partners, and then, the other sort of approach that we take is if we can get three or four or five of us together, we can be kingmakers, queen makers, right?
Speaking on that, and this is what I always found interesting. I got a friend of mine that he has an incredible, investing experience, right? Background, incredible results as well. And so anytime he's investing into something, he says, "Hey, do you want to invest in it?" I'm like, "Yes, 100%," because I trust on them, right? And that's, I would imagine you're kind of the same. It sounds like the same way in the regards to the kingmakership, right? Where it's, hey, you know what? All these other individuals are investing into it. My question is, it sounds like you guys are a very strategic approach, right? You guys take a very active role with your founders and your portfolio companies.
We do.
How do you have that dialogue and that conversation with other investors, with other VCs that are on the cap table? Maybe they are part of the board, maybe they are having that conversation to make sure that there's alignment. There might be differentiation on the board, and I've seen that a little bit. So how do you guys mitigate that to ensure that, hey, you know what, this is the founder and the dream of the product or the company and the mission of that?
Well, look, you want diverse opinions at a board. I would argue that you make better decisions if you have people challenging others in an appropriate way. So I think I would start with the premise that having challenging dialogues in a boardroom is a good thing, right? It teases issues out, it teases things to the surface that might sit and fester otherwise. So that's a good thing. But going into it, we spend a lot of part of our process is talking to whoever the lead investor. We don't lead. We don't set terms. So we want to talk to the lead investor. We want to understand their philosophy because, quite frankly, they're typically behind the wheel, right? They're the driver. They're establishing terms. They're generally picking people that will help drive the board decisions. And we'll start talking to them. We'll talk to other investors on the cap table, especially if we know them. And so we do a lot of diligence talking to other investors before we invest. And then I think you just keep open dialogue. I mean, I don't think it's as complicated as people might make it seem. I think it's picking up the phone and not just sending a text and calling somebody. Zoom would work. But you have to have dialogue to make sure that people. I think there are times people come into a boardroom and maybe weren't aware of an issue, and half the room may be and half the room isn't. That's not a great situation. So if you're talking and if there is good communication in advance, and a good CEO will make sure that their board people are up to speed on the issues that they want and need to have dialogue and decision around. Again, I don't think it's not easy, but it's not complicated. It's
Well, yeah, and I appreciate you explaining that because I do believe that obviously, iron sharpens iron, right? Other, difficult positions. And what I've noticed, I've been on some meetings and of boards and investors, and things get heated. They're very passionate where the company should go this way and the company should go that way, and they're very, focused. Obviously, that happens, right? So my question is, that's a good environment, which is good, but also how do you facilitate growth where it's not actually debilitating the company, it's not destroying the morale, it's not destroying the founder, it's not destroying the investor, other investor ecosystem, but it's actually facilitating a growth environment, right? Because I am a big believer in iron sharpens iron, having those passionate arguments, because obviously that facilitates better transaction, but making sure that it's a growth environment. And how do you make sure, like you mentioned, communication? It's I think you said it's not it's simple, but it's not easy. And I'd love to just talk a little bit about that, how you navigate that, because people get intense, and those are intense conversations.
So I guess the good news is because we tend to have a small place on the cap table, we tend not to drive those discussions. So my my approach frequently is to listen and to try to be a consensus builder or try to I find that my role is frequently more of a mediator, intermediary in those sorts of situations because there are other people who, you know, who are maybe the chair of the board and maybe their firm has got 10 times, 20 times as much capital at risk as we do. You know, yeah, I guess their opinion does matter more than mine, or maybe it doesn't matter more, but there's certainly a heavier weight if you got a bigger place on the cap table. And given we're small, I can come in and I can share a strategic position. I can share why I think somebody is right or maybe somebody is wrong as a from my perspective as a hospital system. So and I can try to influence and mediate, and I tend to try to find a nugget of common ground to build on.
That is, and I love what you mentioned, listening, because that's exactly one of the skills you talked about earlier on, right? Is underwriting and listening, and how that has been a massive skill in the way you are the media for a lot of these conversations. So let's dive into your listening. Okay, when you're an active listener, I think it's so funny because it's an interesting conversation, but it's a subject that a lot of people suck at, quite frankly, right? Very, very horrible at it. They're just not, right? How do you listen? What are certain things that you do that make you stand above everybody else that really kind of lack that quality or that characteristic of being able to listen effectively and navigate that?
So one of the first things I learned, I think I mentioned early on, when I have a question that comes to mind, I write it down rather than just blurt it out and maybe shut off a stream of consciousness that somebody's coming at you with, or a line of dialogue that you're having. I write the question down so I don't forget it. And then it's down and I can go back and focus. And then I like to look at the people. If I'm on a phone call, you can't do that as easily, but I try not to, have my phone. Used to that. I'll turn my phone over so I don't even see if I want to focus, I'll turn my phone over so I don't see messages coming in and get tempted to just take a quick look, right? It'll only take a second, but in that second, you miss, you disengage. And I think it's about being present, which people don't do as well, I think, anymore. People are not as present. And we work at being present as a within our office, where we actually are trying to proactively build that back into our routines, being present. But I think that's the key to active listening, is being present. And if there are little tricks like I have with which write stuff down, which again was not my idea. I was taught that in a Xerox sales training course. They probably don't even do that anymore. There was a company called Xerox, which some people still remember, and um, they had the best sales training program in the country that I was privileged to go through one of my very first jobs with Air Liquide, and that was one of the things that they taught: be an active listener, write stuff down, get back to your customer. The other thing that I learned that from way back then, so this is going back 40 years now, was um, when somebody says no, it's an opportunity to ask why, right? And as a salesperson, I was getting rejections all the time. But if I didn't know why I was getting a rejection, I couldn't either come back with a solution later or say, yeah, you're right, I can't solve that. Yep, I can't, go to my competitor. And I did that with a couple of people. I said, you're right, I can't solve that problem. You should be, if I were you, I would go to this competitor and not that competitor. And quite frankly, I gained a lot of credibility and ended up going back. And when they did need a vendor as a backup, I became their second vendor, right? So I think there are those sorts of things that you can do to position yourself better for the future while if you're present, if you acknowledge people, you look them in the eye. I mean, I used to do little things when I would call um, on customers, and I would make a point of making sure I knew who the executive assistant or the secretary outside, what her it was typically a woman at that time, what her name was. And if I could find out what her kids were doing, if I knew anything about her, I kept cards on these people. And every time I'd go back, I could strike up a conversation, and people felt like they were important, right? So, if people feel you think they're important, they'll actively engage right back with you. And then you have two-way engagement, and you have really rich conversation.
Win friends and influence people, and I appreciate kind of foot stomping on that and double clicking on it, because even though we hear about that all the time, it is a skill, and I'm so glad you acquired it. And it's so funny how obviously you're using that skill to facilitate the right conversation and that growth mentality on the investor committee, on the board, with your portfolio companies and how you're able to integrate that into every aspect of your business and how you think about it. Neil, I really appreciate you being on here, talking about just your history, your journey, as well as just how you think about investments and specifically in the medical and healthcare industry and the exciting stuff that's going on and the revolutionary aspect and but also having those tough conversations, the tough dialogue with the founders and anticipating having some leniency, but also having the tough expectations and certain, identifying the key red flags and green flags. For those that want to reach out to you, maybe invest or co-invest alongside you, how do they reach out to you, my man?
So you can certainly reach out to me at my email, which is neil.wyant, neil.wyant at ventures, or uhhospitals.com.
Awesome. Perfect. And those links will be in the description. I'll put his LinkedIn. I'll put his website. I'll put his email down there. I appreciate you making yourself so available. You put your email. So I'll put your email down there as well so they can just, send you a quick email and connect. I would highly recommend it. He's just got an extensive experience. Sadly, we had to let him go because he's got some other really busy meetings and so forth, but I appreciate Neil being on here. Before I let you go fully, though, I always love to ask my guests this one last question. I mean, you've done very well for yourself. You're an investor. You're an active investor. You're C-suite. You've done incredible stuff. If you think about that young Neil, right, kind of just, walking around, just trying to figure out life a little bit, what insecurities did you have to overcome to become the successful Neil Wyant that you are now?
Well, I guess externally I always exuded self confidence, but internally I was always questioning it, right? So, sort of like taking a deep breath and putting yourself at risk in front of people or perceived risk was something I had to learn how to do and engage with people. And even when I was nervous about it, just step outside of that shell a little bit and get comfortable with that nervous energy.
That's awesome. Intentionally getting in that uncomfort zone because that's how you grow. So there was this, oh, interesting. Interesting. Guys, that is my friend, the one and only, the managing partner at University Hospital Ventures, my friend Neil Wyant. Guys, that's Journey with Christian D. Evans podcast. Until next time, be uncommon if you can.